My name is Chris Lemoine, and I'm an athletic trainer and a manual therapist here at Momentum Fitness in Arlington, Texas. I want to talk to you today about manual therapy. Manual therapy is a must-use recovery tool. It's important to make sure that you utilize enough time to allow the tissue to respond, as well as use the right tools, pressure, to make sure that they're getting the active benefits needed to lead a comfortable, healthy, and pain-free life. When doing a manual therapy session on a customer, it's important to use, like I said, the right tools, techniques, and use the right organization of these tools and techniques to make sure that the customer is getting the best and optimal and pain-free session possible. We always begin with a light massage just to get the client to relax. The next thing that we do is we may use two different possible tools depending on the tissue and the area that we're actually working. One tool source is Graston tools. So these Graston tools are metal tools in order to be able to get underneath the fascial tissue, and they're all different shapes and sizes based on the body part that we're working. So as you can see, that long one that I just showed you is probably going to be for a big muscle belly of the quad, maybe even the hamstring or the calf, and then one small like this will be utilized for maybe the fingers. Another technique that I use, and I don't use this the same as other clinicians use, is cupping. These are silicone cups. They do not crack, they do not break. When I apply these cups, I do not like to leave the big rings on the tissue. Reason being is because when you do that, you actually burst capillaries. And if you leave it on too long, it may actually cause inflammation of the tissue, and then the whole therapy session will not be as effective because the skin is going to be so sensitive. Well, as discussed, it's important to have the proper order of treatment. First things first, our customer now is here on the table. We have to apply a massage technique just to loosen him up. So customers come in and he's complaining of lower back pain. So we're going to focus on his lower back. In a given 1 hour session, you're probably going to be focusing on the area that's at hand or any other areas around that area that are affected. I apply my emollient to the area, and get in the tissue and just gently massage the lower back. As we do that, we're trying to automatically feel for any type of knots or adhesions that may be in the area. That way we know exactly where to target when we apply the other tools. Now, after massaging the area, now we need to determine what tools to utilize. It's mostly his entire back that's tight. So because it's his entire back, I'm going to utilize GT1 of the Graston tool technique to loosen up the tissue. And what that does is it helps to improve blood flow and circulation. It also, because of the grooves in the Graston tool, helps to pick up on that underlying tissue and helps the fascia to begin to relax. Now, it's not going to actually make it better 100% because there's probably going to be some knots after we release this that we'll identify after we apply the Graston tools. Once we do this for a specific amount of time, no more than 2 to 5 minutes, if the tissue appears to be more matted down, we might apply a cupping technique. Now, when I apply a cupping technique, I like to do a stripping method. I don't apply a whole lot of suction, and I like to strip away at the tissue. What this does is it picks up on the skin, much like picking up on the top layer of this table. And what that does is as we drag the tissue across, we're not causing the capillaries to burst, and we're also bringing more blood flow to the area and not creating that inflammation of the skin. After we disconnect, if you notice, the skin is red, but you don't see those red dots or those octopus tentacles that people call it on the skin. After we apply this technique, now the tissue is way more pliable, and now we can really get into doing more active release and fascial distortion model techniques. Fascial distortion model techniques involve a lot of manipulative therapy or tactile pressure upon the skin, getting deep enough to really break through all those adhesions. I like to tell the customer that it feels like speed bumps. Once we get to those speed bumpy areas or those knots, then we want to slow down and slowly break up those adhesions. What I like to do is I like to get feedback from the customer while I'm working on this tissue. So, for example, as I'm applying this pressure and applying a pressure to this knot, I will ask the customer, give me a pain number of 0 to 10. 10 being extremely painful, 0 being no pain. What would you say?
5.
5. So right now, the customer is feeling a pain number of 5 out of 10. That's a mid-range pain number. That means that we're right on the spot in the knot. It's not extreme, but again, it's not comfortable. We then want to apply this pressure for as long as it takes until the customer starts to get some relief. So after about 30 seconds to a minute, you ask them again, what's your pain number?
3.
3. So as we can tell, it's working, the pain is slowly subsiding, and the adhesion is starting to get smaller. And then finally, to top it all off, we want to make sure that, like we did at the beginning, we give a good massage at the very end to make sure that they feel really good. This is more of a sensory feedback type of method, just to make sure that the customer feels good. I always like to make sure that they feel good before they leave. That way they can continue on with their day feeling really good. As far as the treatments go, how many do you need? How often? Well, what I like to tell customers is we have to check and see how you feel within the next 24 to 48 hours. More than likely within the next 24 to 48 hours, you're gonna be sore. It's not gonna be the same type of pain sore that you felt before you came in. It's gonna be more of a soreness from the treatment itself. It's gonna be a little bit of inflammation that's gonna be involved, but icing, Aleve, resting, drinking plenty of water is definitely recommended. Within the next 48 hours, once that's completed, you're gonna feel plenty of relief, way better than you did before. As far as frequency, how many treatments do you really need? It really depends on how long the adhesion's been there or how long you've been feeling this way. If you've been feeling pretty knotted up and it's in multiple areas, you may need to come back within a week. But I've had customers come in once every month because it just made them feel better after one session. So if you want to know a little bit more about this, again, please reach out to me. My name is Chris Lemoine at Momentum Fitness. Again, I'm an athletic trainer and a manual therapist. We'll talk to you soon.